Brazil every week right here.
Tune in the Brazilian Hour every Saturday night at 11 on KSJE Farmington. 12 minutes past 8 o'clock. It is Wednesday morning. It is the 21st day of the second month, 2024. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM over the air here in San Juan County, New Mexico. In Durango, Colorado, we broadcast all the time at 103.3 FM. And if you're anywhere else on the planet and want to tune us in, just go to our website. And that is KSJE.com. Or if you've got one of those smart speakers lying around, ask it to play KSJE. And if it's smart enough, it'll do just that. We also want to welcome our viewers who are joining us this morning. The video of this program is streaming out live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everybody. We are so glad that you are with us because coming up in the next few moments, we are talking with a local business, Kare Drug, about the services they provide to the eastern side of San Juan County and a lot of things that they do that nobody else is doing these days. And so we'll talk about that, medical care, and more coming up in the next few moments right here on KSJE this morning. Then later on this hour, we'll check in once again with Ron Price. He has another great piece of advice about living life in the sandbox. That is coming up today at 8:50 a.m. right here on KSJE. Next hour, I'll turn the studio over to Mick Hess. He is hosting, of course, our classical music program, Roving with the Arts. He comes on the air after the news at 9:06 on KSJE today. And that'll take us to 10:30, our local and regional author program with Delcherie Gladden. And this week, Delcherie is speaking with Kevin Jones about his latest book called A Quick Trip to Moab. You'll hear about that coming up today at 10:30 on Right on Four Corners, right here on KSJE. Also want to remind you to enter for a chance to win tickets to the performance coming up here to San Juan College on Friday, March 1st at 7 p.m. at the Henderson Performance Hall called Right in the Eye. It is based on the cinematography work of Georges Méliès, the French filmmaker who was making movies almost 100 years ago, even more than 100 years ago. Learn more about that and enter for a chance to win tickets at ksje.com/tickets. You can also connect with KSJE on X, formerly known as Twitter or Instagram. And if you're a podcast person, we invite you to subscribe for free to KSJE Podcast on sites where you're already listening to podcasts and maybe discover a new program that you may have missed. Outside our studios here at San Juan College, it's a cloudy Wednesday morning, mild, 41 degrees so far. We're expecting a mild day today, but a windy day as well, and maybe a 20% chance of a passing shower today with a high of 58 in Farmington, but wind gusts possible up to 45 miles per hour this afternoon. Overnight tonight, partly cloudy skies, low 30 degrees. Tomorrow, partly sunny with a high near 50. Sunshine on Friday with a high of 51, 56 by Saturday, maybe lower 60s by Sunday with overnight lows all the way from 30 degrees to lower 40s. I'll be back with my guest right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. The caregivers of San Juan Regional Medical Center are committed to bettering the quality of life, health, and care of individuals, families, and our communities. Life is their sacred trust. Better is their mission. Here is their home. San Juan Regional Medical Center, improving the health of the Four Corners since 1910. And back in Studio A this morning with my guest, as I mentioned, from Kare Drug. The owner of Kare Drug is with me this morning. Ashley Seyfarth is here. Good morning, and thank you for coming in. Good to see you.
Thank you for having me.
You bet. We've been trying to get you here for a long time. We talked during COVID when you were really, really busy, and we basically just got you on a Zoom call for about 2 seconds. But life has gone on since COVID for all of us, and so we wanted to bring you back and talk about some of the things that you are doing with Kare Drug, and talk a little bit about the company and the drugstores that really serve an important population on the eastern side of the county.
Yeah. COVID was a whole new environment, right?
Right.
We worked really hard. We have a wonderful team that really did a lot of work. I was very lucky. A lot of people stayed with us during that crazy time, and we did our best to take care of, both communities, Aztec and Bloomfield. We ended up doing 9 drive-through events to provide vaccines for people when they first started, and we got a really great compliment. We were told we were as efficient as Chick-fil-A, and I was told that was a really good compliment.
That's high praise.
For,
I think
for
so.
a vaccine clinic. So it was a great deal, and we had a lot of support. Yes.
Right. But you have a long history with Kare Drug. We were talking before we came on the air this morning about your involvement with the company. You were working with them, and then ended up actually buying the company after a few years. Correct?
Yeah, that's correct. I started with Kare Drug when I was a student at the University of New Mexico. I'm from here. I'm a local. Grew up in both Bloomfield and Aztec. And so I started with them a long time ago. I've been there 11, 12 years, I guess. And so I became a partner with them when I graduated. Took me a few years, of course, for them to learn to trust me and me figure out the business and how it was going to run. But I started as a partner in 2017 when I took over the Aztec location, and then my other partner retired in 2019 when I took over both pharmacies. I asked if he was psychic, of course, because...
The timing of 2019, right?
Oh, yeah. He retired right at the end of 2019, and, he would come in during COVID and tell me he was glad that he wasn't there, but he was glad we were doing okay.
Right.
Yep.
And it's been almost, I don't want to say a blur last few years, but I mean, it seems like the company is doing well and coming up with new and innovative things to provide to your customers, to your patients, to your clients, and we want to talk a little bit about that as well. But the point is, I think too, is that you serve a really important audience and clientele there on the eastern side of the county. And you were telling me that you've got customers obviously in Aztec and Bloomfield, but from Flora Vista all the way east, I would say, through Blanco and Cedar Hill and Navajo Dam. I mean, that's kind of your market area, right?
Yes, that's correct. So we serve as a huge side of that county. We provide deliveries out to people that just, they're homebound still for whatever reason,
Sure.
and get them taken care of. We've done deliveries out of the locations for a long time. And so during COVID, and of course, this new everything is delivered, our deliveries have really increased. But we provide services to all those people. We even went out and gave shots to people that needed them in their homes, especially during COVID, to make sure they were taken care of. So, it's fulfilling. But yes, all the way from Flora Vista, all the way out to Navajo Dam community, all the way up to Cedar Hill and down to Blanco, and it's a big area.
Right, all of that, and of course, there's really not other options in Aztec or Bloomfield. I think there's maybe a grocery store pharmacy, but other than that, it's really you.
It's really us, yeah. And we're one of 2 independent pharmacies left in this county. Unfortunately, there's only 55 independents left in this whole state. And so, but the strong will survive. And so we come up with new, innovative ways to take care of people and service our communities the best we can.
Right. And that's an important distinction, I guess, too, because you're able to maybe offer some more of that maybe personalized service and maybe see a need in the community that's not being met by the bigger guys, and that you're able to kind of offer. And that's certainly what we're going to talk about today as well.
Yeah, we offer, we're the only ones that do it in this entire area. We offer a packaging system, and it's free of charge to our patients. It's called the Kare Pack.
With a K.
Kare, obviously.
Obviously, right, yes.
It's called the Kare Pack, and it's great. It's our team manages the entire thing. We offer it now finally to both of our locations, and we've got hundreds of patients on it that just really like it. It's great. We've had a lot of testimony from patients saying that, this generation, the younger generation, is taking care of the older generation, and so many are staying at home now. So the younger kids are trying to package medications and put them in the little planners, and basically we just take that over, and it's made a lot of people's lives just really give them some peace of mind, because they know that mom or dad or grandma took the medication. They're doing it appropriately and as prescribed.
And that's what this does.
That's what this does.
If someone is taking multiple medications and they have to do it once a day, twice a day, whatever, there's a little container or pack that then they can just open and take what they need to take at the time they need to take it. Is that the idea?
It's really neat. It's what we call strip packaging. So they get a really nice box and they just pull out the strip and tear off the morning pack. We have some Parkinson's patients that we take care of, and we can pack their medications up to 9 times a day because unfortunately they have to take them that often.
Sure.
And so it makes it really, really easy, very simple, peace of mind for people when they're on our system.
Right. And this is offered free of charge, you said?
Free of charge.
To
our patients.
Patients,
yeah.
right.
We do have a way that we can provide this service to those that, that are forced to use the mail order systems. And I understand that. A lot of them are having to do that because of the co-pays and things like that, and we get that. But we charge those patients if they want us to package their medications. But it's still it's very reasonable rate of, it's just $20 to have us package the medications for them if we don't fill them.
Got you.
Yeah.
And that would be from like a third party provider, I guess, for their drugs, which may be insurance based or what have you. Is that kind of how that works? Exactly.
Yeah. So we have some veterans that bring us their stuff and allow us to package those medications because it's a simple peace of mind service for them, and they appreciate it so much. So they're willing to pay that little bit of charge to have that done.
Right. Very true. I wanted to ask you too about just running a business, of course, and coming out of COVID, and that's been maybe challenging. I always hear from folks about it's hard to find people to work. We heard, I think, some stories about even the bigger guys that were having a hard time finding pharmacists to fill some of their stores and things like that. That's got to be a constant challenge, I guess, is how I would phrase it. I don't know how you would phrase it.
Yeah, it is, and it's across this nation. I think a lot of people, we're seeing a huge decline in people that want to go to pharmacy school, but really all medical professions, because they saw how beat up we got during COVID. And so it is very hard to keep staff, but we've been really fortunate. We haven't had a ton of turnover. I try very, very hard to really take care of not only our patients, but our employees as well. And I would like to think that, they keep coming back to us. So,
well, you mentioned your team early on in the interview during COVID and things like that. So a lot of them are still with you?
They are. We have a lot of our team that was with us during COVID are still there. We have somebody that's been with Kare Drug for 36 years, and she's phenomenal. And then, the other employees, 17 years, 12 years. I mean, so yes, we do maintain. Now we have those few. Everybody has personal reasons that they leave us or whatnot. But yeah, we've done really well. Our team is phenomenal.
Very good. Well, congratulations, because I'm sure there's a lot of other business owners who would love to be in that situation with the team in place for multiple years.
Yes, it's great. And what that does too is that provides really continuity of care, because when you come in, you're not a number to us per se. Granted, if you're a new patient, we're going to try to get to know you, but it's great. I can ask people, when they come in, how their cruise was, and it was the baby born, was the grandchild born, things like that. And so we really do try very hard to give that personalized service and care.
Right. Very good. The other thing I wanted to ask you a little bit about is this branches of care that you've recently, I think, launched, and talk a little bit about what that means for patients and others of Kare Drug. And this is all about the Branches of Care Clinic. And so talk to me a little bit about that. That is actually having a provider that's available for your clients.
Yeah. So
patients? I keep using the wrong term. I
patients.
Apologize.
Well, I have clients too, but
okay.
Patients for sure. Yeah. So, as an independent pharmacist, we see a lot more of what happens with the drug side and the exploitation of our healthcare system with numerous middlemen in between. And so when I came across, it's called Big Tree Medical Group, and so they are our partner in this project that we've launched. They essentially showed me the benefits. If we get rid of the middlemen, we can actually provide affordable health care. And I'm not talking about like the skew on affordable healthcare, like truly affordable healthcare. And so what we did is we built out a little area in the back of our Aztec location is where it's at. And We have a provider in there. Her name is Marcy Patton, and she has over 25 years of experience. So she's got a really great knowledge base. But she, too, was tired of providing primary care to patients and having to deal with the insurance companies all the time. And so this allows her to really fully just provide you the service you need. So instead of her, we hear about it all the time of people being, oh, my doctor didn't even listen to me. I had 15 minutes with them, and, all they did was type on their computer. Unfortunately, that's not really their fault. It's the healthcare system because of the insurance companies and the regulators.
They need to see so many patients perhaps during their day in order to make it
exactly
I guess, affordable for the insurance company or whatever, right?
Or the system that they work for. Yeah, for sure. And so when we decided to open this thing, I thought, we really want to price this to be truly affordable. We're going to help patients that we see day in and day out that don't have insurance. They will walk away from their medications because they can't afford them through the insurance. They won't go to urgent care, and they come into us as the pharmacist as kind of front line. And, we pride ourselves in being accessible like that as well. But these patients just needed something that they could see an actual provider. And so for the clinic is membership driven. So it's $70 a month, and it's plus tax, unfortunately, because New Mexico a few years ago decided to start taxing medical services. So it's $70 a month plus tax, so it comes out to like 74 or something.
Okay.
But what that allows you to get with the $70 a month is full unlimited access to the provider.
Unlimited?
So, unlimited.
You said unlimited. Okay.
Unlimited.
All right.
So,
not just once a month, but if I need to come back, I can come back.
She has some patients that just really, truly needed this. And what we've seen is she's been able to get them well controlled. They had undiagnosed hypertension or high blood pressure, diabetes, different things that they needed somebody, but they couldn't afford insurance to go anywhere. And so she's able to bring them in. She's seen them a couple times a month, and then let's say they got strep, and so they come back in and see her. That's no extra charge. Mm-hmm. That's still a part of your service for your $70 a month. In addition, we're making that piece of it affordable, so you can see her as much as you need to, or as little, I guess, if you didn't need to see her.
True, right.
But then also included in this, the cost of drugs can go down when, again, you get rid of the middle people. When you get rid of what the insurance company is charging, when you get rid of these people in the middle called pharmacy benefit managers that are just really increasing the cost of medications right now, when you get rid of all those people, generic medications are very affordable. And so what I did is we put on there a formulary of 180 medications that are included in your $70 a month.
Okay, got it. I think I follow, right? So that means that they're included for no extra charge. Is that what you're saying?
That's correct.
These 180 different types of drugs, and I guess they would maybe be for high blood pressure or some of the common maladies that maybe people might present with. Is that kind of the idea of why you chose those 180?
That's correct. Yeah. So we have a whole list of antibiotics that are, they're inexpensive. And so the antibiotics, blood pressure medications, there's a whole slew of medications on there. So if you come in and you get diagnosed with hypertension or that high blood pressure, potentially it's that $70 a month and no extra copay. So we'll provide that medication for you to help get you truly affordable care and get you taken care of.
And I think, if I know my audience, I think their brains are probably trying to calculate all this and understand this new kind of concept in healthcare, because we always think about insurance and copays or high deductibles or things like that. And so I think that's part of maybe the message here, and maybe the thought behind putting this together is to maybe do the math and figure out, would this be cheaper than your high deductible healthcare plan or what have you for these types of things. May not work for everybody, certainly, but I think for a large number of folks who live and work here in the county, it might be an option.
Yeah,
and
absolutely.
For small business owners too. That's another big part of this, right?
Yes. So this is another way we've really been able to, as a small business owner, the insurance costs are just, nothing's going down anymore. Everything's going up. And so,
And you want to provide benefits to your employees, your team, as you said, who are so dedicated to you. What can you offer to them?
yeah, so my team does get access to the clinic now as a part of one of our employee benefits. And so, but it's great. And, we've had several businesses now start to put their employees into it. But it's the first time, we heard one business owner tell us, I have never been able to even offer any kind of healthcare service to my employees. And in this day and age, it's kind of a hard thing to do because it's part of the problem, right? We need to stay competitive and be able to retain employees. And so it's given them a retention factor.
Right.
And they're really grateful for, being able to do that.
Sure.
But sick visits, all of that, they can just send them in and say, hey, they really need to be seen, and they're back on the job a lot quicker.
Right.
Yep.
And what does that mean for dependents or spouses or things like that? Are there options for that under this plan as well?
Oh, absolutely. I mean, because we're going to keep it affordable. So we have plans for spouses, so couples rates that are discounted. And actually, I guess I should say we do have a discounted rate for the employers as well. So if they put 5 or more employees in, we start discounting that down for them.
It's not the $70 plus tax. It's less than that.
It's less than that. Yep. And again, it's to help our community, because we see all the time people that don't have insurance, or like you said, those high deductibles. And I would say there's some skeptical things about not having insurance, and I understand that. This is the 4th year my family and I will go without insurance because we just can't afford it. It's outrageous. And so that was another driving factor of kind of our own life and how my husband and I deal with some of the things that not having insurance has to do. And that helped kind of see the need for others in the community and other small business owners for sure.
Right. And we always hear, too, a lot about preventative health care, which certainly would save society money, I think, in the long run, right? If more of us took care of our health before something serious pops up,
right,
that saves a lot of money. I mean, tens of thousands of dollars, if not millions in the future, right?
Yes.
Of not having to deal with some of these chronic health conditions as we get older.
Oh, yeah, for sure. If you can catch things early and get it taken care of before it progresses into having to see that specialist and things like that. And, I will say, going back to kind of the high deductibles, I wouldn't discredit having insurance and having, those high deductibles, but at least with this, if you had a high deductible, you kind of have that catastrophic coverage in the back of your mind. So the what if,
Sure,
something happens, you have that to fall back on. But this at least allows people to get into a provider as much as they need to, and have their primary care stuff offered, but also those sick visits and things like that as well. So we're seeing a huge benefit already to some of those patients. She's really started to turn around their care, and they're so grateful, and that makes my day. It really does.
I bet. Well, and I'm glad that you brought that up, because I certainly don't want to recommend that anyone give up maybe their insurance if they have it at the moment.
Right.
But this is another option for maybe adding to it, or so you're not paying those maybe you have a really high copay of $70 or more, and this maybe would be a great option, especially with the unlimitedness of it every month. And that's, I think, the main difference.
Yeah. We offer other things too. Our provider, Marcy, is certified in DOT physicals, so she can provide all of our CDL, our truck drivers, their licenses to maintain their licenses. And so we noticed that there was a big need for that side of the county to have that offered, and so she's certified to do that as well. And then we also, I still understand if you can't do the $70 a month and you're like, well, I don't know how much I'd actually use it. And I get that. And so we also offer a walk-in visit. So say you do have strep or RSV or flu, that's going around right now. You can walk in. It's $120 for a walk-in visit. But it includes one of those tests, and it also includes up to 3 medications. So yes, it's priced a little higher than our monthly service, but you're still getting the same like care and services offered. So, you're getting that extra test if you did have RSV, and then also, an antibiotic or a steroid or whatever needs to go alongside with that illness. So there's a lot of value in that visit as well.
Right. My guest this morning is Ashley Seyfarth. She is the owner of Kare Drug in Aztec and Bloomfield, talking about the services that the store provides to the eastern side of San Juan County. And I guess if somebody drove over from Farmington, you wouldn't turn them away.
We actually have a lot of Farmington patients that frequent both of our pharmacies.
Right.
Yes,
or even Kirtland, or even further west. It doesn't matter, right? So we don't want to leave it like that. But we just have a couple of minutes remaining this morning, and I guess what's the future plans for Kare Drug? I would think with your one provider, maybe two, or maybe something in the Bloomfield area. Is that the ultimate goal?
Bloomfield so desperately needs a provider. That is my goal. I would love to see it get busy enough, that Branches of Kare gets busy enough that we could maybe bring on another provider and have a clinic in our Bloomfield location, because we so desperately, again, we just need that care throughout this community, and accessible care.
Right.
And that's really the goal of everything. But, as a small business, we're always looking to expand our services. I guess I didn't even talk about, this last year we had something called Test and Treat for our pharmacist. And again, it's that lapse in care, and it's that people need things done now, and our poor ER and our urgent cares are just overwhelmed and overloaded. So this last year, the governor signed a couple of bills allowing pharmacists to provide testing for strep and COVID and flu and all of those, and there's actually some more coming. And the pharmacists now have prescriptive authority. So if you come into the pharmacy and say you're in Bloomfield, and you come into the pharmacy and you're like, I've got strep, it's our pharmacist can run the test for you and then write you a prescription if
confirm that you actually do have strep.
If it's positive. Same thing with flu. You can come in and we'll test you for flu, and if it's positive, we can get you what you need to get better real quick. So yeah. Wow. So we're always trying to help wherever we can and where people need it, and yeah.
Good to know. And one final thing, and we were talking this before we came on the other this morning too, about lab services, and that's another area where healthcare costs maybe have gotten a little out of control, and you have found maybe another possible solution to that with another lab that you use that keeps those lab costs lower.
Yeah, absolutely. So, when somebody's looking at a clinic like ours, I mean, this is not a new concept across the U.S., but it's very new to our area. And so the question is, well, how much are labs going to cost me? It's going to be $70 a month, and it's going to be labs and all this stuff. Well, we've contracted with a lab that turnaround is 3 days, so it's nothing like any other lab in the area. But instead of paying $100+ for some of these labs that they're running here in the other labs in the area, the lab actually offers really great deals. So you can do a full thyroid panel to have your thyroid checked for less than $20. A liver test done for less than $10. I mean, it's almost sickening.
To know what the other labs are charging, I guess, right?
Well, again, I wouldn't say it's their fault necessarily.
Right, no, but it is what it is.
It's the middleman in between that is just draining this whole healthcare system.
And for those of us that aren't familiar, maybe, can you give us an estimate of what maybe a thyroid lab might cost somewhere else? Is it double? Is it triple?
Oh, it's $130, $150 to run that panel.
So it's too early for me to do that math, but it's certainly more than triple.
It's more than triple.
Yeah, okay.
Yeah, so again, I think that, as an independent pharmacist, we try very hard to help patients where we can. We reduce patients' copays when they're too expensive, because we know the actual cost of the medications. We can tell because we have to manage that inventory on a day-to-day basis, and our team is phenomenal in trying to catch some of that stuff and help provide the best affordable care that we possibly can. I have no intentions of ripping people off. I just can't. I wouldn't sleep at night. And so my goal is to really have a business that people can go to, they can trust with their care, they can get everything that they need potentially, and they can walk away going, wow, that was awesome. Yeah.
Right. Very good. Well, Ashley, thank you for coming in to talk with me about Kare Drug and the things that you're providing to the eastern side of the county. We really appreciate it, and best of luck to you. Come back anytime.
Thank you so much for having me. Appreciate it.
You're very welcome. That's Ashley Seyfarth. She is the owner of Kare Drug, located in Aztec and Bloomfield. My guest this morning right here on KSJE.